Well, good afternoon, everybody. So an old sage goes that repetition is the mother of skill. So forgive me for repeating myself on a number of admonitions as it relates to the issue of personal responsibility, as it relates to addressing foundationally the transmission and spread of COVID-19 and the importance and potency of our own individual choices, our own personal responsibility as it relates to mitigating the spread of this disease. It is incumbent upon all of us to recognize what is self-evident, and that is that it is our decisions, not our conditions, our decisions that will determine our fate and future as it relates to the spread of this virus. It's our decisions that will determine how quickly our children go back to school. It is our decisions that will determine what kind of activities we get to once again enjoy with our friends and family. And of course, it's our decisions, personal and sum total of all of our decisions, that will determine how quickly our business sector can reopen with some semblance of the way things used to be. It's important to remind all of us that this transmission can be substantially mitigated by wearing face coverings, by wearing face masks. This slide we present is pretty self-evident, and I think the evidence is overwhelming. We've seen in other countries as it relates to the importance and potency of wearing face coverings to mitigate the spread of this disease. Recommendations now from the CDC clarifying that point of view, and clearly now an increasing number of people that are taking the personal responsibility not only protect themselves, but to protect others. And I just want to thank all of you that are doing that, for practicing the kind of behavior that will allow us to move past this pandemic sooner than we otherwise would. The issue of going outdoors and taking activities specifically that traditionally have been indoors and now moving them outdoors, obviously also to the extent airflow is a big part of that, can mitigate the spread of the virus as well. And that's why we talk often, not just about masks, but the importance of moving indoor activities outdoors. Accordingly, we talk about physical distancing, social distancing. Some refer to it physical distancing, just being 6 feet apart from people you otherwise do not mix with, people that are outside of your household, people that you come close contact with when you're out doing the essential day-to-day work that we all need to do. Fewer people you mix with, the significant reduction in the likelihood of seeing others contract the disease, and of course you as well being impacted by this disease. This next slide bears, I think, some consideration and reflection. I put this slide up a few months ago, it's worth putting back up today. The power of exponentials, this notion that just an individual that is positive, that comes into contact over a 5-day period with just 2.5 people. Within 30 days, those 2.5 people start mixing with others, and now you have over 400 people that have come down positive with COVID-19. You see just a significant, rather modest by some people's estimates, but significant in terms of its impact, reduction in the number of people you've been exposed to. You just cut that in half from 2.5 people to 1.5 people. Now you're only impacting over a 30-day period through the power of those contacts, 15 people, and less still if you reduce your exposure to less than one individual. And so the point is, we have to minimize our mixing. We have to minimize the transmission of this disease. We have to minimize that by practicing physical distancing, wearing the face coverings, and doing the kinds of things that I think are well described and obviously now need to be more vigilantly followed if we're going to move past this more expeditiously. Last week, on Monday, I put out this new dimmer actions that we're taking in the state of California and what we've done statewide. We talked about those counties that are on the monitoring list, 33 counties, and I'll give you an update on those county lists here in a moment. Again, focusing on indoor operations, on gyms and fitness centers, places of worship, still allowing activity to occur outdoors. Accordingly, issues of barbershops and personal care services. I want to just make personal clarification on the issue of personal services. This was the slide we put up a week ago relating to indoor activity. It was our intention to provide for barbershops and the likes to be able to do their work outdoors. Turned out that was more challenging than it may have appeared. The good news is we now have new guidelines out on the COVID-19.ca.gov website, COVID-19.ca.gov website, clarifying what we can and can't do as it relates to haircuts and activities that we want to move indoors, outdoors for personal care service industry. Turns out, without getting into too many details, but issues of chemicals and shampoos and perms, it was more complicated than some had considered, particularly as it relates to local ordinances and rules and regulations that were in place. So we worked through that over the last number of days, and those new guidelines are up, and hopefully that provides some more clarity. If we need to provide even more, we'll get the good feedback, which I anticipate from the new guidelines we put up. But rest assured, the intention was to provide those activities with conditions outdoors, no longer indoors. Here's why. Again, we're seeing an increase in our 7-day average, total number of COVID-19 positive cases. Yesterday, July 19th, 6,846 positive cases. 7-day average, you see up there, 8,911. We take a closer look at our positivity rates, number of people tested, number of people that test positive, becomes a positivity rate, with now record 7-day average of daily tests, over 124,000 daily tests on average over 7 days. By the way, 127,000 tests yesterday. Our positivity rate over a 14-day period is holding at 7.4%. This time last week, it was at 7.4%. Our 7-day positivity average last week was at 7.7. When I announced on Monday, it's now at 7.2%. So 14 days holding at 7.4. Our 7-day dropping from 7.7 over a week ago to 7.2. Let's get under the hood, as we tend to do here, and look at the numbers a little bit more closely. That 7.4% rounded up, you see 7.39% positivity rate over a 14-day period. This represents about a 9.2% increase over a 14-day period. So you saw a big increase, and now we're seeing some stabilization. But again, no one is satisfied being north of 7%, and we got close to 8% last week. So these numbers can change very, very quickly, again, depending on our personal behavior, sum total of which will determine the direction of the lines on this graph and ultimately the direction of our ability to reopen this economy and get our schools back open, as all of us so desperately look forward to. As it relates to hospitalizations, we've seen a 16% increase in hospitalizations over a 14-day period. By the way, that is an increase, but it is a decline in the increase we've experienced over a 3-week period. Let me, without confusing you more, be more specifically. 2 weeks ago, we put up on Monday our hospitalization numbers. It said we were increasing over a 2-week period by 50%. Last week, Monday, over a 2-week period, we were increasing by 28%. This week, over a 2-week period, we're increasing by 16. So 50, 28 to 16. That's an encouraging sign, but I will enliven you with some additional thoughts in a moment as we walk through not just hospitalizations, but ICUs, and then start breaking things down by county. Remember, these numbers are statewide, in the aggregate in our state. None of us live in the aggregate. All of us live somewhere in the state, and there's a very different picture that you can paint depending on where you are in the state that is not painted by this chart. That said, again, it is encouraging to go from 50, 28 to 16%, but we want to see a decline, not a reduction in the rate of growth. Total population of individuals currently in our healthcare system, about 9% are identified as COVID positive, which is about where we left the week last week, often Monday, roughly 9%, traveling anywhere where numbers are anywhere from 8 to 9% consistently over the last few weeks. But we're moving in a direction again where we're seeing pressure on the hospital system. We'll unpack that more in terms of where, but total hospitalizations with COVID-19 patients represents 9% of the available hospital beds within our healthcare system capacity. ICUs, again, hospitalization numbers go up. Invariably, you'll see ICU admission increases as well. Not dissimilar to the hospitalizations. 2 weeks ago, we announced 50% on the hospitalization increase over a 14-day period. 2 weeks ago, I announced a 39% increase in ICU admissions. Last Monday, it was a 20% increase in ICU admissions over a 14-day period. Today, you'll see that slide, 12% increase in ICU admissions over a 14-day period. So not surprising. Hospitalizations, ICUs, tracking, but lagging indicators, one another. We are seeing a reduction in the rate of growth, but a rate of growth nonetheless, which only reinforces the seriousness of this moment and the importance of taking the personal responsibility we all must to practice the physical distancing, do our activities outdoors as much as we can, and obviously wear face coverings. So that gives you a sense of where we are in ICU admissions. Let's get closer to what our total capacity is within our critical care system. You'll see there that chart, about 17% of the ICU capacity, and that includes ICUs and NICUs. And that number, those are for younger people, that number, 17%, has been in the 15 to 17 range over the last few weeks. So total system, we feel like there's more of the orange you see on the chart than the blue. But again, certain parts of the state, this is absolutely not the case. You can reverse those colors and you'll see real constraint in ICU capacity. I'll be specific in Placer County today, just 18.6% of their ICU beds are available. There's parts of the state, it's even less still. San Benito, 0%. The ICU capacity available in that county. Again, an indication, county by county, that things look very differently than they do system-wide or state-wide. And that's why it's so important to go back to this list, this monitoring list. Here are the 33 counties. This is the total number of counties that are on the monitoring list in the state. San Francisco did come on the county, which we had anticipated, announced that likely to happen Friday, did. And we are currently monitoring with very close technical assistance provided. These 33 out of our 58 counties in particular because of a number of issues related to criteria they set forth where we're not seeing things necessarily improve in all those critical areas. And so, again, this is a list that we are laser focused on. This list represents the overwhelming majority of the population in the state of California. This is a list where if you reside in these counties, we just only reinforce and underscore the urgency of the individual activities in terms of modifying our activities to help us mitigate the spread. In many of these counties, and I highlighted Placer County, Napa County, and others, we are seeing constraints in ICUs. A number of these counties more challenging as it relates to hospitals. And that's not just beds, that's individuals staffing the beds. A lot of parts of the state now where we are seeing an exhausted frontline staff of credible doctors and nurses and nurse practitioners that are being stretched, and we are helping to provide some semblance of support, including the support we received last week I want to thank the Vice President for that support. 190 individuals. Medical team came from federal HHS to help relieve some of that stress. So that is indeed top of mind in terms of where we are in certain counties, San Joaquin, Stanislaus in particular, that we have been monitoring very, very closely as it relates to hospitalizations, ICUs, and the issue of human capital, meaning personnel that need a break, that need to be supplemented, need to be supported. As always, I end these presentations, as I often begin them, by encouraging you to wear these masks, as we did today. Once again, encouraging you to practice the physical distancing, wash your hands, sanitation, always top of mind, and one of the most potent things you can do to minimize the transmission of this disease, and then minimize mixing, large crowds of all types, and encourage you to continue to take seriously and take vigilant and be as vigilant as possible to work through the next few critical weeks in terms of the pandemic here in the state of California. And just close with one additional comment, and that is we had a relatively low and, again, devastating number, 9 deaths yesterday, but relatively low in terms of numbers we've seen in the past, devastating for those families that were directly impacted, loss of a loved one. And our heart goes out to each and every family. And again, a reminder of how deadly this disease is as well. But I've said this in the past, when you've seen numbers go up, you've seen numbers go down, best to look at these trend lines over a 7-day period. And while the numbers were low yesterday comparatively, we've averaged 91 deaths over a 7-day period in the States, a little better than the 102 deaths, tragically, we were losing the week prior. But 7-day average, tragically, is 91. Just on Saturday, we lost 90 individuals. Sunday reported in 9 individuals. So I want people to be cautious about running with that news as somehow that's a trend or should be a headline, when in fact we should be very sober about the loss of an average of 91 human beings over the course of the last 7 days. So look, we want to continue to do more on testing. We're going to continue to ramp up those efforts, and I'm pleased that we're seeing an increase in the total average number of daily tests in this state. We're going to do more that we can to get that positivity rate to start trending down, not just try to mitigate its growth. Hospitalizations and ICUs continue to be a cause of concern in this state, and that's why we want everybody to double down on everything we have been doing so that we can get back to school, get back to work in the traditional ways, not just these modified ways with distance learning and modifications that make work activities more challenging, certainly, than they were pre-pandemic. So that's the update for today.